trying to improve the landscape of healthcare for patients with brain trauma. And one of the
Mm,
things that I did when I was interviewing a lot of patients, families of patients, family members of patients, I was interviewing a lot of practitioners who have had years working with patients. And one of the themes that I noticed is that our intent is very important. So, first of all, it's about having a mindset, a belief that I can have a quality of life. I can be happy. I can have all the things that I want to do. I can still do everything I want to do in life, despite having, ALS or brain trauma, right? Of course, I'm talking about people who still have, who are not in a coma or vegetative states. That's what I'm talking about. Because severe brain trauma, some people end up there, and
right.
they're in vegetative states. But even then, there have been discoveries of some patients with vegetative states. They're not able to speak because they're in comas, but there's a certain level of a coma where they have enough awareness that through functional MRI, they still have self-awareness and they can answer questions, simple yes or no questions in the functional MRI. So that shows how dynamic our brains really are,
Hmm.
and that our it's it and I don't want to use the aphorism, the cliche of mind over matter, I don't want to
Right.
use that cliche because that's really not what I'm getting at. But what I am saying is that what you believe to be true in your life can become true if you combine that with action.